Joining me are my colleagues Jordan Thurman and Marcello Palmieri, who work with the Enterprise Solution Consulting team in Adam. Jordan will be assisting with the Q&A while Marcello will be presenting. But before we get started, I need to make you aware of a few things. This is a 1-hour webinar. We're going to try to make sure that we keep this under 1 hour because there's several of you on the line. We'll have everyone muted to ensure that we have the best possible sound quality. That said, you can communicate with us via the WebEx dashboard. If you have any questions for Jordan or Marcello in our Q&A segment, you can type them directly into the Q&A panel. And we hope to get to all of your questions during the webinar, but if we run out of time, we will contact you directly via email or phone to answer your questions as soon as possible. And we are recording today's session, and you'll be receiving a link to the recording after the webinar concludes. Finally, a quick disclaimer. All information from this webinar was gathered from the public domain. All names and logos are property of their respective owners. Adam does not promote or endorse any of the products or services that are mentioned or displayed on this webinar, nor is Adam affiliated with any of the organizations mentioned, unless specified. Okay, with that said, it is now my great pleasure to introduce you to today's presenter, Marcello Palmieri. Marcello is an enterprise solution consultant for Adam who works intimately with hospitals and healthcare organizations. He's been in the industry for over 10 years and is nothing short of an expert in this field. I know you're going to love what he has to say. So without further ado, Marcello, take it away.
Hi, this is Marcello Palmieri, Enterprise Solution Consultant with Adam, and welcome to this live webinar entitled, Why Aren't Patients Using Your Portal? Okay, so in this live webinar, we're going to look at some of the research regarding patient portals. Specifically, we're going to take a look at some of the reasons why adoption rates by patients are so low. Hospitals and other healthcare organizations are investing tens of thousands of dollars, and in many cases, millions of dollars, yet it seems that only a small percentage of patients are accessing and using their patient portal. So we're going to take a look at some of the reasons as to why this is happening. And we're then going to look at some of the action steps that you can take to reverse this and to get patients to log on to your patient portal system. So let's quickly define what a patient portal system is and how patients can benefit from their portal system. According to the healthit.gov website, a patient portal is a secure online website that gives patients convenient 24-hour access to personal health information from anywhere with an internet connection. Using a secure username and password, patients can view health information such as recent doctor visits, discharge summaries, medications, immunizations, allergies, and lab results. Some patient portals also allow patients to exchange secure email with their healthcare teams, request prescription refills, schedule non-urgent appointments, check benefits and coverage, update contact information, make payments, download and complete forms, and view educational materials. With Patient Portal implementation, your organization can enhance patient-provider communication, empower patients, support care between visits, and, most importantly, improve patient outcomes. And so with all of the benefits that come from Patient Portal systems, why are adoption rates so low? So let's begin with some research published by Xerox. And Xerox supports more than 1,900 hospitals through a variety of technology solutions, including meaningful use assessments. In their 5th annual EHR survey on the usage of electronic health records, where they polled 2,017 adult Americans aged 18 and older, they discovered that 64% didn't use an online patient portal. And for more than half of those who didn't use a portal, approximately 57%, they reported that they would be much more interested and proactive in their personal health care if they had online access to their medical records. And Xerox found that many Americans are open to getting medical records online if given instruction on how to obtain access by their medical providers. And so one of the problems is that many patients are simply unaware that patient portals even exist. Among those who don't use a patient portal, 35% didn't know a patient portal was available, and 31% said that their physician had never spoken to them about patient portals. The survey goes on to state that for patients who do use online patient portals, 59% said that they were much more interested and proactive in their personal health care since they received access to the patient portal. According to Tamara St. Clair, the Chief Innovation Officer of Commercial Healthcare for Xerox, she states that with providers facing regulatory changes, mounting costs, and patients who increasingly seek access to more information, the Xerox survey points to an opportunity to address issues by simply opening a dialogue with patients about patient portals. She goes on to say that educating patients will empower them to participate more fully in their own care while helping providers demonstrate that electronic health records are being used in a meaningful way. The survey results from the Xerox study also suggest that healthcare providers could make progress toward meeting meaningful use Stage 2 requirements and improving care by focusing on the portal needs of millennials. And this study defined millennials as those aged between 18 to 34 years, and baby boomers, who were defined as those aged 55 and older. So let's take a closer look at some of the findings for these two groups. Millennials, a mobile generation, are more likely to report the highest preference in accessing patient portals on the go. About 43% are on smartphones. Millennials are more interested in their medical records than any other content in their online patient portal. Millennials also want to be able to view personalized recommendations to improve their health, as well as information about additional services from their doctor and industry news about health topics of interest to them. Many baby boomers who don't use patient portals said that they would be much more engaged in their care if they received access to medical information online. 56% of those aged 55 to 64 and 46% of those aged 65 and older. Baby boomers aged 55 to 64 accounted for the highest percentage, about 83%, who said that they already do or would communicate with healthcare providers through a patient portal. Tamara St. Clair, the Chief Innovation Officer for Commercial Healthcare for Xerox, goes on to say, guiding different generations to take advantage of the information available at their fingertips can play a key role in preventing chronic diseases and reducing the cost of care. Okay, so let's move on to some other published information in this important area. There's a very interesting article entitled Hospitals, Why Are You Surprised That Nobody Wants to Use Your Patient Portal? And this article can be found on the Becker's Hospital Review website. And it talks about how difficult it is for patients to navigate websites and log into their patient portal. It also mentions that hospitals are struggling to engage just 5% of patients required to meet meaningful use Stage 2 measures. The article then goes on to list 3 simple mistakes hospitals make in their approach to the patient portal. Mistake number 1, hospitals and health systems aren't selling what's in it for the consumer. The article states that hospitals that are struggling to reach meaningful use requirements should reconsider the end goal of the patient portal. The technology is meant to create an easy path to engage patients in their health. Part of the problem is no one is directly responsible for connecting and engaging patients with the technology. IT teams are accountable for implementing EHRs and building patient portals, but not necessarily for adoption. Hospitals should think about the user experience and develop a tool that's useful and convenient for patients to increase adoption. Mistake number 2. The website surrounding the patient portal is not up to snuff. The article goes on to say that even a website from 2012 looks old. It decreases the value of the EHR investment because it doesn't engage patients. Hospitals can start to improve their websites by simply keeping location, services offered, and schedule information up to date, and make the website compatible with mobile devices. You wouldn't put up with outdated information and technology on a restaurant website or an online banking account or a retail web page, so why should patients deal with it on your hospital's website? Mistake number 3, the online experience doesn't inspire confidence in consumers. Here, the article states that it's critical to build a relationship with prospective and existing patients from start to finish. This is something even the nation's top health systems struggle with. Clunky patient portals often reroute to third-party sites with different URLs and even clunkier, outdated designs. Things such as the color scheme, font choice, and stock photos used can either inspire trust and credibility or make patients feel weary about entering confidential information about themselves. And this can be fixed with a simple HTML skin, so patient portals reflect the online brand of a hospital's homepage. And the article concludes by saying, seamless, up-to-date websites help build rapport with patients before asking them to cough up all of their personal information on the patient portal. Otherwise, it's like asking someone to marry you on the first date. Okay, so let's quickly recap some of the problems and barriers that prevent patients from logging on and using their patient portal system and taking advantage of all it has to offer. Problem number 1, many patients are unaware that patient portals even exist. No one ever talked to them about it or told them where they could find it and why it's important to use it. Many patients, unfortunately, are simply unaware of patient portals. Problem number 2. Many patients don't have easy-to-understand instructions and training regarding their patient portal system. Patients might not know where their portal system is located or how to log on to it. They probably don't have clear and simplified instructions about how to navigate the system and may not know how to use it properly and incorporate it into their daily lives. Let's take a look at an example of what could go wrong when patients don't have clear, easy-to-understand instructions and training regarding their portal system. In an article entitled "The Problem with Patient Portals," published on the Medical Practice Insider website, and they provide business and technology intelligence to physician practices, the article states, there's a real risk that patients will misuse a patient portal for emergency situations. And although most portals have disclaimers that urge patients to call the practice or 911 in the event of an emergency, we will most likely hear of situations where patients used a patient portal to request emergency care and the request was not attended to with the normal emergency diligence. Problem number 3. It's a mistake to assume that older patients won't use your patient portal system. In an article entitled "The Business Case for Increasing Patient Portal Adoption" that can be found on the Healthcare Informatics website, the article states that physicians will say, I have older patients and they never get on a portal. But according to Josh Gray, Vice President of Athena Health's Athena Research, and they connect 85,000 providers and health systems nationwide, Mr. Gray finds that portal adoption falls off a little after age 65, but not a ton. He goes on to state that their research indicates that patients in their early 60s are just as likely as those in their 40s to adopt a portal. Problem number 4. Patients may not be aware of all of the benefits available to them when using the patient portal system, and they may not be aware of the positive impact it can have in their health. And as a result, they might not use the system because they can't see how it's going to make their lives better, and they can't see how it's going to empower them regarding their health. Problem number 5. Patient portals are usually accessed from the hospital's main website, and having old, outdated-looking websites with poor designs and poor-looking patient portals that are difficult to navigate doesn't inspire trust and confidence in patients, and this can deter them from even coming to your website and portal system and interacting with your technologies. Problem number 6. Many patient portals and hospital websites aren't mobile friendly and mobile responsive. It's no surprise that smartphones and tablets are everywhere and that everyone is using them. So if your hospital website and patient portal system aren't mobile responsive and compatible with these devices, patients simply won't access them. According to an article entitled Number of Smartphone Users in the United States from 2010 to 2021, published by Statista, an online statistics organization, the United States is one of the largest smartphone markets in the world. Among the top 3 markets, China, US, and India, the United States has the highest smartphone penetration rate. For 2017, the number of smartphone users in the United States is estimated to reach 222.9 million, with the number of smartphone users worldwide forecasted to exceed 2 billion users for 2017. Problem number 7. No one is directly responsible for connecting and engaging patients with the technology. Although IT teams implement an EHR and build a patient portal, they don't necessarily ensure adoption of the EHR. Okay, so we've talked a little bit about some of the issues regarding why adoption rates of patient portals are so low. Let's now review some of the ideas, strategies, and action steps that you can implement to help your organization increase its adoption rate of your patient portal. Step 1. Create a plan of action to educate your staff, from your colleagues who work in the marketing department to the clinicians who treat the patients, so that all team members are aware internally about this very important initiative. Educate your staff about how much time, resources, and energy your organization has invested into the patient portal and about the benefits patients and their families get from the patient portal. Educate your staff so that when they interact with a patient at every step of the way, they remind and educate the patient that they have a patient portal that they can log into and access their file and all the valuable resources at any time and from any location. Step 2. Help your staff understand how to communicate with patients. Oftentimes, we might just start listing all the features and advantages of something like a software or portal system, but it's much more powerful to communicate the benefits of something. So when your colleagues are interacting with patients, we believe that they'll get more enrollment and higher adoption rates if they clearly communicate the benefits of the patient portal, not the features. So for example, when one of your colleagues, let's suppose it's the physician, and when she talks with the patient, instead of saying, you can log into the patient portal to request a prescription refill, what they can say instead is, you can save a lot of time and energy and no longer have to wait on the phone for 15 or 20 minutes or in person in long lines for your prescription refill. You can now do this whenever you want, from wherever you are, through your online patient portal. You can be at home with your family, and in just a few minutes, with a few clicks, you can easily and quickly request a prescription refill hassle-free. Now, this is much more powerful than simply saying you can log into your portal system and request your prescription refill. There's an interesting article entitled 4 Ways to Increase Patient Portal Usage and Boost Patient Engagement on the Bridge Patient Portal website. The article states that to provide an initial introduction to the patient portal, you can have staff assist patients with portal registration at check-in or check-out and provide step-by-step instructions for entering demographic and insurance information required for that day's visit. Making tablets or kiosks available at check-in is a great way for patients to begin the process. You can send patients home with a handout about the portal in order to reinforce the message. Hanging posters promoting the portal in waiting rooms and exam rooms is also a very cost-effective way of raising awareness. The article also talks about assigning a care coordinator. The article states, if your healthcare organization uses patient care coordinators to promote health awareness and help patients reach their care goals, you know how integral these individuals are to the care team. They work with the physician and patient to develop a care plan, they communicate the provider's plan to the patient, and they continually assess the patient's needs. They also play a vital role in expediting patient portal adoption. Another important point the article makes is that, and I quote, physicians have one of the most important roles in promoting the patient portal. In fact, patients who are encouraged by their physician versus another staff member to begin using the portal are more likely to do so. However, the physician's role doesn't end after suggesting that the patient create a portal account. Once patients are using the patient portal, the physician must continue to reinforce its use. One way to do so is by mentioning the portal at each visit and specifically referencing a feature and benefit in which the patient might find valuable. Additionally, the physician should take on a central role when it comes to portal communications. Any messages going out of the portal, for example, should be addressed from the physician rather than the hospital or practice. This doesn't mean that the provider must physically send all communications, but rather that his or her name should be added in the quote-unquote sender field. And the article lists some other useful information, which you can view online at the Bridge Patient Portal website, which we encourage you to check out, as well as all the other articles and references presented in this webinar. Okay, so let's continue. In this next step, we suggest that when communicating with patients and when creating instructional materials for patients, it's critical to create short, clear, simplified, easy to understand instructions when training and helping them learn how to use the patient portal system. Use short words, short sentences, and short paragraphs in your communications. There's a great quote from Leonardo da Vinci where he said, "Simplicity is the ultimate sophistication." So look at things from the perspective of your patient. Put yourself in their shoes and make things simple and easy for them. Also look into creating short video trainings, which you can then post onto your hospital website and share through social media websites. With today's technology, you can easily create a video training where you can record your computer screen and walk patients through the patient portal system and how to use it. These screen recording softwares are very inexpensive, and you can also find some that are free, and they're very easy to use. Anyone can use them. And of course, using video is a very powerful way to communicate and educate your patients. In this next step, make sure that the design, look and feel of your website and patient portal system is current, uncluttered, and clean. Do a website audit. Ensure that all elements are laid out properly with enough space in between text and graphics so that it's pleasing to the eye. Also ensure that you're using current graphics. A few other key points are: use 1 to 2 different font styles and 1 to 2 different font colors and justify the text and graphics left. As I mentioned earlier, outdated-looking websites and portal systems don't engage patients with the technologies. In fact, they deter them from returning. Another critical element of your website and patient portal system is to ensure that they are mobile responsive. According to an article entitled "Mobile, a Likely Key to More Patient Portal Use," posted on the American Medical News website, it states, patients now handle much of their banking, emailing, and social networking on mobile devices. The University of Pittsburgh Medical Center, or UPMC for short, found that patients wanted the same convenient access to their test results, medication, and problem lists. It turned out that UPMC's patients weren't the only ones. In 2011, UPMC's EHR vendor launched iPhone and Android apps because of a growing demand from its hospital clients. And so responsive design is a critical factor in today's world. And aside from having a clean, current, and responsive website and patient portal system, you also need to ensure that they're easy to navigate and include the right calls to action. So as an example, many hospital websites simply include the words patient portal somewhere on their webpage, sometimes at the top and sometimes on the sidebar, and hope patients will find it on the website. We suggest that you include a call to action, such as click here to log into your patient portal, and insert this call to action on the top left side of the web page, because in Western culture, we read from top to bottom and left to right. And you may want to bold the text or change the font color or increase the font size to ensure that it stands out from the rest of the text on the page. You want to make it very easy for patients to see, and you want to be clear and specific on the action that you want them to take. And so if you want patients to log into the patient portal, you need to provide them with the exact action step to take. Another strategy you may want to use is to include links and embedded messages throughout the content on your website directing patients to the patient portal. So as an example, let's suppose that you have an article on your website that educates patients about the importance of taking their medication on time, not missing doses, and getting prescriptions refilled. In the middle of the article, you can insert an embedded message like, to request your prescription refill, you can log into your patient portal at any time. And you can also include a hyperlink that connects them directly to the patient portal. So we've talked a little bit about website and portal system design elements, but the most important thing about these technologies is that they must add value to the patient. Patients will go to their hospital website to access their patient portal, or they may need to call the hospital and look up the phone number or address, or may read about the treatments and services offered. But once they have this information, is there any need for them to come back to your hospital website and spend more time on your website? Probably not. And your hospital has probably spent a great deal of time, money, and energy on creating and maintaining your hospital website. And so we suggest that by having a website that adds massive value to your current patients, it will encourage them to keep coming back to your website. And with the right design, calls to action, and embedded messages, you can encourage them and educate them and direct them to use your patient portal system. And so one of the ways to add massive value to your current patients is through credible, trustworthy information and education about important health topics relevant to them. For example, if your patients are experiencing some kind of pain or want to research and learn more about a certain health topic, where do they currently go? Are they coming to your hospital website to get valuable health information that they need, or are they going somewhere else? Again, we suggest that by having a website that adds massive value to your current patients, it encourages them to keep coming back to your hospital website. And again, with the right calls to action and embedded messages, you can educate them and direct them to use your patient portal system. Having a website that adds massive value also helps serve your community and helps attract new patients to your organization. Okay, so this concludes the main topics that we wanted to cover in today's live webinar. And before we get into the Q&A session, I'd just like to mention a few words about the ADAM organization. ADAM is one of the leading sources of healthcare information and multimedia visual learning assets for hospitals, healthcare organizations, educational institutions, employers, and the pharmaceutical industry. We work closely with these organizations to offer end-to-end solutions for all their health education needs. So as an example, if a hospital needs accredited patient education materials for their portals or websites, we can help. And this is just one of the many solutions we have to offer. And here are just some examples of the educational assets we have to offer. Our interactive and integrated medical encyclopedia consists of thousands of URAC-accredited patient education articles, HD videos, microlearning e-learning programs, interactive decision support tools, interactive health risk assessments, online calculators for fitness and health, patient education for EMR systems, and much more. Hospitals and other healthcare organizations leverage our medical encyclopedia to help their patients and consumers throughout the entire continuum of care. And ADAM has been helping clients for over 25 years, and we really are one of the most trusted and respected organizations for healthcare education. And again, these are just some of the educational solutions we have to offer. We work closely with many organizations, from hospitals to organizations such as Epic and even the National Library of Medicine, to name a few. And so if you'd like to learn more about ADAM and our services, you can email me at marcello.palmieri@ebix.com, or you can reach me by phone at area code 514-277-9000, extension 207. We'd also like to hear your feedback about this webinar and what you thought about it. And we'll send you a short survey after the webinar. Your input is very valuable to us. And if there are other webinar topics you'd like us to cover, please send us your suggestions. We really listen closely to the needs of our colleagues and partners like you, and we do everything we can to support you in reaching your health education objectives. And before we get into some of the Q&A, we'd like to mention that we have a special offer for you. If you're interested in any of the solutions that ADAM has to offer, we're going to reduce or waive our implementation and account setup fees depending on the type of solution you may need, which means that you can save quite a bit if you choose to work with Adam and get started in the next 90 days. Okay, so I'll turn it over back to William for some Q&A.
Great. Thanks, Marcello. I appreciate your presentation. What a great job and a great offer as well. I want to bring in Jordan for the Q&A, the answers and questions and answers. Jordan, are you unmuted now?
I am. Can you hear me?
I can. So I saw there were a few questions that came in. So what were some of the questions that you got?
So I have one here. It says, what portals have you worked with, and would content from Adam work in any portal? And the answer for that actually is that we have worked with multiple portals, such as Influence Health, who has a portal, Epic, eClinicalWorks portal, Meditech portal as well, and we're willing and able to work with any portal because it's as easy as actually just kind of, it's really just the HL7 search functionality and capability that's needed to put into place, and we have all of that content ready to go and be searchable by medical code from any system that you have.
Great. Okay. Do you have any other questions from the attendees?
Yes, I do have another one here. It says, I used your Adam content several years ago, and from what I could tell, it was not responsive. You mentioned that the portals needed to be responsive in the presentation, so what have you done to improve upon that? So actually, as of now, all of our content, all of our library, interactive content, any of the tools that we have is completely mobile responsive, so it would work from any device, and we've seen that that's really helped some of the adoption rates of our content. We've worked with several large hospital systems in the past, especially over the last 2 years now, and they have full mobile solutions that are included in, within MyChart, and our content fits very well into that. It can be wrapped into the portal as well, so there's a lot of customization that we can do. We can match colors and fonts to that end, so that we can make sure that it fits, that it looks like it's your website, that none of your users or the people that are coming to visit your website feel like they're being taken off site or anything. So we keep it really wrapped up into your site, and then we make sure that it's responsive no matter where they're coming from.
Okay, thanks, Jordan. Any other questions? Nope, sounds like that's it. Okay. Well, again, thank you everyone for attending. As I mentioned earlier, we recorded today's session and we'll be sending out a link. Feel free to share the presentation with your colleagues. Again, thanks again, and we hope to see you next time. We're also available 24/7 at adam.com. Have a great day.